So hello and welcome to today's event. My name is Belle Workman and I'm a Senior Research Fellow at Melbourne Climate Futures based at the University of Melbourne. And I also co-convene the Earth System Governance Planetary Health Justice Working Group with Professor Catherine Bowen. And it's my pleasure to be able to facilitate today's event. Thanks very much for joining us for this roundtable where we're looking to share with you the work to date of the Planetary Health Justice Working Group, and where we will invite you to actively contribute to the development of the working group's strategic direction by providing you with the opportunity to input into our draft roadmap that we have initiated as a group. But before I go any further, it's customary here in Australia, where I am based, to commence a formal event such as this with an acknowledgement of country. Accordingly, I acknowledge the traditional owners of the unceded land on which we work, learn and live, the Wurundjeri, Woiwurrung and Bunurong peoples here in Naarm, Melbourne, which is where the University of Melbourne has its primary campus. I also acknowledge and am grateful to the traditional owners, elders and knowledge holders of all Indigenous nations and clans who have been instrumental in our reconciliation journey. I recognise the unique place held by nations and clans who have been, I recognise the unique place held by Aboriginal and Torres Strait Islander peoples as the original owners and custodians of the lands and waterways across the Australian continent, with histories of continuous connection dating back more than 60,000 years. I also acknowledge their enduring cultural practices of caring for country, which is pertinent given the topic of today's session. I pay respect to elders past, present and future, and acknowledge the importance of Indigenous knowledge in the Academy. As a community of researchers, teachers, professional staff and students, we are privileged to work and learn every day with Indigenous colleagues and partners. So I am joined today in this roundtable event, which we're hoping to be relatively informal, by most working group membership, which includes Professor Catherine Bowen and Dr. Rebecca Patrick, who are in the room just around the corner from me, as well as Rosalind Warner, Scott Carlin, Giorgia, Dalla, Libera, Marchiori, Sophie Robinson and Elise Moo, who have all been instrumental in the development of the roadmap. I'd particularly like to acknowledge the substantial efforts of both Sophie and Gio for their contributions to the roadmap development. It's been an absolute pleasure to work with such an incredible group of people from very diverse disciplinary backgrounds, and you'll see on the website the diversity of backgrounds and also geographical locations. And we're really excited to continue working together in the years ahead. The working group was established in late 2022 to really contribute a health lens to the Earth System Governance existing efforts on planetary justice. Applying a health lens can elucidate inequities experienced by different communities and population groups. And the working group really seeks to complement and extend the work of the Planetary Justice Task Force by exploring questions of health justice and equity in the context of planetary change. It seeks to pursue efforts to address human health disparities by empowering, elevating, and facilitating the inclusion of at-risk and marginalised populations in conversations that inform from our contributions at the last two Justice and Governance conferences. Our major milestone as a group to date will be the publication of a special issue by the end of this year in the Earth System Governance Journal that explores the concept and application of planetary health in the context of Earth System governance. Thanks, Catherine. Apologies if the sound is not working well. Can everyone hear me okay? Excellent. So just to flag for those who are joining us online and who are yet to access the draft roadmap, it is actually available for you to download and review on the ESG program website under our event for this particular event on the schedule. but also you're welcome to scan the QR code on this slide to access a copy of the draft roadmap, which you can then review in further detail following the session. I'll just leave that up for a minute so that people have a chance to get their phones. So to facilitate today's discussion and to seek your feedback, we're really looking to provide to you a high-level overview of the roadmap's contents. The roadmap captures our collective expertise as a working group and articulates our plan to leverage and maximise impact in the next 3 years. Now is a pivotal time for actions that advance planetary health justice. Core to a planetary health approach is a commitment to urgent, transformative, and transdisciplinary action, underpinned by a radical shift in values and practices to align with our increasing understanding of safe and just Earth system boundaries. Historical non-Indigenous trends such as population growth, imperialism, and extractivism are root causes of planetary health injustice, and we have identified 7 progress areas to address these drivers of planetary health injustice, which we'll introduce to you shortly. Our progress areas have been selected as areas of interest, as well as areas of expertise among our working group members, and given their synergistic positionality to one another, which we have conceptualized using the socio-ecological model, as shown on the graphic in this particular slide. We see the roadmap as articulating a transdisciplinary program of work that is ambitious in its outlook, endeavouring to operate at scale across jurisdictions. We're fully aware that we have set ourselves an ambitious agenda, and some might argue perhaps overly ambitious. We're not ignorant to the fact that achieving the scale will require involvement and contributions from stakeholders and networks well beyond our working group. And we hope that today's discussion will harvest innovative and creative ideas and strategies to help us achieve this goal over time. To be a difficult and successful implementation of this roadmap, engagement with groups whose voices are often not heard. And we'd be grateful for your ideas about how to meaningfully engage hard-to-reach communities and ensure Indigenous knowledges and practices are embedded in our activities from the outset. To this end, we see this roadmap as very much in draft and as a live document that will evolve and iterate over time given the dynamic political economic environment in which we live. Very briefly, in terms of activities, the roadmap presents our high-level thinking on taking the agenda forward. We anticipate next year will be dedicated to exploring in further detail the interrelationships and synergies between identified progress areas, characterising the conceptual and theoretical underpinnings of progress areas in the academic literature, and establishing research plans for 2 progress areas that we will prioritise and take forward. We have identified indicative activities for 2026 and 2027, although acknowledge that these will likely be revised as we progress work in 2025. So now my working group colleagues to present a 5-minute overview of the 7 progress areas we have included in the roadmap. This will hopefully spark some questions for you in terms of these areas, as well as to help you think about important ways or areas we may have inadvertently missed. And I'm going to pass to my colleague, Scott Carlin, for the initial overview. Scott, please feel free to let me know when you need me to swap slides.
Absolutely. Thank you very much. I'm delighted to be here with everybody, and time is short, so I'm going to press forward. The world system privileges the economy above all else. Yet this is a lie, a dangerous lie. We can complain all we want about the propagation of misinformation in our world, but it is our cautiousness around cultural myths that also needs our focused attention. Next slide. I don't see slides on my end. Should I be seeing them?
They have moved for me. Have they not moved for everybody else?
I also didn't see
It looks
the earlier.
good.
So we can currently see the Stockholm Resilience Centre's economies and societies as embedded parts of the biosphere.
You're seeing the three rings, right?
Correct.
Okay.
Yeah.
I don't see those, but I'll proceed. We do not have a global governance system that privileges its core foundation, the biosphere. We do not have a global governance system that ensures the well-being of societies living within the biosphere. What we do have are our endless amounts of speeches and cultural norms that distract us from the work that our societies must do. These opening remarks were inspired by the recent failures of the United Nations Summit of the Future. For example, the Climate Governance Commission, a civil society initiative, proposed that the UN General Assembly declare a global planetary emergency at the 2024 summit. The goal would be the creation of a planetary emergency plan coordinated by the UNSG. Nothing remotely close to this call was undertaken by the UN. Let us not turn away from this prescient call to action. ESG researchers can play a vital role in identifying why the UNGA failed to heed this request and, more importantly, devise a framework that ensures a planetary emergency plan is enacted and implemented with great urgency. This month, the 2024 State of the Climate Report, Perilous Times on Planet Earth, was released. It concludes, we are currently going in the wrong direction, and our increasing fossil fuel consumption and rising greenhouse gas emissions are driving us toward a climate catastrophe. Next slide, please. In that context, let me address the ongoing and valuable work to implement a well-being economy. First, I would start by stating that the work that is happening in places like Scotland, shown on this slide, and New Zealand deserve broader visibility and mobilization. The well-being economy should not be understood as the ultimate goal, but rather as a set of strategies that permit broader policy experimentation and also build public support for new social welfare models. The well-being economy governments, or WEGO, partnerships were launched in 2018 and include the governments of Scotland, Iceland, New Zealand, Wales, Finland, and Canada. The well-being economy efforts are primarily shifting the focus away from the economic and toward the social lens. For example, New Zealand aimed to reduce the percentage of children in poverty before housing costs from 16.5% to 10.5%, but in actuality, it fell to 13.6%, certainly moving in the right direction. Some of the key strengths of the WEGO model are introducing innovative policymaking, strengthening partnerships and collaborations, and aligning national and subnational goals with the UN SDGs, also shown on the prior slide. As one research team recently remarked, New Zealand's initial experience has frequently pointed to positive, incremental improvements that fall short of being transformational or sufficient to address core social and environmental challenges. The primacy of economic growth remains, and much more work needs to be done to strengthen the capacity of policies and programs that regenerate the regional and global biosphere. One promising area is linking health and well-being. The World Health Organization has supported well-being economy initiatives and is eager to see these improve public health. I also hope the WHO can help explore how these can accelerate the achievement of public health goals in the global south. Next slide, please. The center image, I know it's hard to see, but the center image is a negatively sloped graph comparing subjective well-being and SDG 12, responsible consumption and production. Its negative slope is a real concern. We effectively need to reinvent the meaning of subjective well-being as we reduce SDG planetary impacts. Large percentages of urban dwellers especially want to expand consumer opportunities. So we face a real crisis, the conflict between ecological realities and public aspirations. Most of the WEGO nations rank high on subjective well-being and low on SDG 12 impacts. In other words, current WEGO policies do not go far enough, as previously stated, in transforming current trends. Lastly, I'll discuss the rights of nature, beginning with the Sacred Headwaters Project, also identified on the current slide, which structures its model around buen vivir, or good living, and is anchored to an explicitly biocentric and ecological model of health at the local, regional, and planetary scale. In this sense, I would argue the Sacred Headwaters Project is an outstanding example of global governance. In fact, their promotional materials explicitly frame their work as a globally scalable effort. This offers scholars an incredible opportunity to take up this challenge to explore biocentric models for other regions of the world, in addition to assisting this particular project. The Sacred Headwaters Project places the biosphere first. The project can leverage the vast territories of forest that remain intact in the Sacred Headwaters region. Therefore, the indigenous tribes in this region do not need to reinvent their cultures. They simply need to protect the forest and their existing cultures. Still, the rest of the world needs to take seriously the vast chasm that exists between ongoing ecological degradation and existing commitments to reduce that degradation. In much of the world, the goal remains focused on sustaining unsustainable lifestyles. Next slide, please. While the Amazon has been a critical global site for building progress around the rights of nature, we do see a genuinely international effort today to codify and implement the new rights of nature. The Global Alliance for the Rights of Nature maintains a timeline of annual milestones that dates back to 1972 and extends to the current year. The growth of initiatives in recent years isn't explosive, but it is impressive and consistent. So I'm looking forward to consistent improvements in that in coming years this decade. The reality is that more cultures now recognize that their future depends upon securing the rights of nature. Work is underway in the country of Aruba to amend its constitution. If successful, Aruba would become the second country in the world after Ecuador to make this transition. We can expect many more countries to formally begin this process over the next decade. In April, Nature became recognized as an official recording artist on major streaming platforms, including Spotify and Apple Music. This allows Nature to generate royalties from her sounds, and those can be applied to things like environmental causes. In conclusion, we should critically examine what David Korten is calling ecological civilization. Please see his new 2024 publication, and assess if this model of governance can effectively meet the diverse needs of nations in the next 20 years. The fate of our planet hangs in the balance. Thank you very much.
Many thanks, Scott, for so eloquently introducing two of our progress areas there, the rights of nature and the wellbeing economy. I'd now like to invite Rosalind Warner to speak to the third progress area on global health security. Thanks, Rosalind, over to you, and I'll change slides.
Well, thanks so much, Scott, for that really comprehensive overview. And I think one of the things that makes this working group so amazing and productive is like the conversations that we have over things like alternatives to the existing economy, the well-being economy, and how it intersects with health. I have a few points on here, and I don't necessarily want to read them all. We were asked, we want to talk about why is this appropriate for the current time? And when I, as a political scientist, when I look at around the world and I look at the headlines, one of the things that's been noted, for example, by the small island developing states over and over, is that they are whatever progress they try to make towards alternative measures, the well-being economy, whenever they make progress, it gets knocked off track by shall we say, an unexpected event. So for example, many small island developing states are just in a permanent state of crisis because they're continually being hit over and over by disasters. And so I think what we need to also maybe take account of when we're thinking about these issues is how we can do this long-term planning, but also keep in mind that we are in a different world, right? We are entering into a very challenging world, and those risks are not distributed equally and evenly. They are not, they're different in every context, in the sense that, you know, we all live on different parts of the planet. But we're also still in an Anthropocene era, which is much more complex and really calls for international cooperation in a way that we haven't seen before. I mean, no country can go it alone. No group can go it alone anymore. And so working together really is the only way out of this. And so we need, that's why, you know, one of the reasons why we really need to pay attention to those the equity in global health equity, right? Is that if for example, let's take global health security, if we think of security, you know, as reduction of exposure and the control of risk in this Anthropocene context, you know, we think of it as a good, like a global public good in a sense. How is that good distributed? And what we realize, of course, is that it's maldistributed. In other words, the security that some enjoy comes at the expense of the security of others. So we have this uncertainty complex, and this is taken from the UN's Human Development Report of 2022, that this uncertainty complex is one in which the costs are unevenly and inequitably distributed. And so this is something that deserves study because of the nature of complexity and the nature of complex systems, but also because of the equity concerns. So this does link up to the Earth System Governance Project, partly because of the systems, you know, framework that's used to understand governance. I think it also has direct implications for governance, because governance decisions are security decisions, and they are health decisions, and they're economic decisions, and they're social decisions, and they policy and governance, you know, is both reflective of the world we live in, but can also be the way in which we make changes, just to echo what Scott said. And, you know, getting the world on an emergency footing is it's a slow turning ship. You know, I was also at the UN Summit of the Future, and even though the discussion was about the future, it was grounded in the present, you know, absolutely grounded in the present and absolutely reflective of the hierarchies that we see around the world today. So how does this constitute, you know, part of the research program? I would say it's directed to questions that I believe have a place in our system governance project, but also have a broader place in literature. So looking at how these governance systems can innovate in order to address health security and the maldistribution of health security and the ways in which countries can work together. I think it can incorporate that notion of complex systemic risk. A lot of this comes from the disaster risk reduction literature and the activities at the UN around disaster risk reduction, but there are lessons there for a wide range of studies, I believe. And I think that there's something to this notion of mutual vulnerability, recognizing that vulnerability is something that is inequitably distributed. Some are definitely more vulnerable than others, but there's an element in which we are all vulnerable. There's a way in which we are all vulnerable. And the more that we can recognize that the fate of others is intertwined with our own fate, I think we can create the basis for incentivizing that global health governance. So that's where I'm coming from. Again, as Belle said, very early days, and so much more to talk about. And I would love to hear what the community has in mind and where they think this might go.
Many thanks, Rosalind. That was excellent as always. As with Scott, incredibly articulate of our initial thinking about what this particular progress area could look like for our particular working group. And I think really relevant to what you were talking about in relation to emergency footing, which I think is a beautiful segue actually into the two areas that Gio will present on next. First, One Health, but then looking at climate emergency declarations at local government levels. So over to you, Gio. Thank you.
Thank you, Val, and thank you, Rosalind and Scott, for the comprehensive overview of what we have been thinking and working on in the last year or so. So it's nice to hear colleagues talking about all the brainstorming that we have been doing together, and also out of their expertise. So I will briefly present two more areas that we have currently in focus in our roadmap. The first one is One Health. Now, I hope that some of the attendees that are here today were attending our event, part of the forum on Monday, where we try to unpack a bit this kind of, this kind of conflict between One Health and Planetary Health. And what we were trying to do during that seminar was really try to, unpack a bit what those terms mean and what are the implications for practice. And I think where we landed is that there's more in common between One Health and Planetary Health that we might think about, but also to be really pragmatic in how we use these terms. And that's why we are bringing in One Health specifically within the work of the Planetary Health Justice Working Group. So for people that are not familiar with One Health concept, it's a concept that was born really historically to address the complex dynamic between human health and animal health. It's really rooted in veterinary medicine and also infection diseases as well, which is a bit of my background. I'm currently working on something very different, but I come from infection disease research. So One Health has been developing in the last decade and really incorporating, concern about environmental issues that are broader than just the connection between human and animals. And I think infection diseases, vector-borne or waterborne, are obviously a big consideration when we talk about climate change. And so really going beyond the disease per se, but what are the connection with the current situation on the planet? Another topic that it's quite central to health and the One Health discussion is also the antimicrobial resistance that we're seeing rising. And again, this is a very complex issue that goes beyond, the bugs that are causing us to be very sick and we cannot fight anymore with antibiotics or other drugs. But it's really about the dynamics and both environmental dynamics, but also social dynamics that we see. And I think what we're trying to do with the One Health concept here and why it's important for us is really to kind of shift a bit the perspective. So you can see in the image here, it's trying to move away from the anthropocentric way of seeing health to a more system way of seeing health. As human beings, we are embedded in a complex system, and that's how we should look at health and how we should address health also in a, from a policy perspective and also from a governance perspective. And that's here just an example why this is very much important in relation to the health system governance agenda. I put here the Pandemic Prevention, Preparedness and Response Accord that is currently under discussion. We come, well, I would say we come out, but we are still part in a pandemic, a global pandemic that has hit very strongly everybody in the world, but as Rosalind has pointed out fairly, not in an equal manner. So some people were hit harder. And so this is very timely. So talking about One Health, and we see it with the World Health Organization really putting a strong emphasis on One Health, really important for countries to think more in a holistic way, in a systemic way when they work on policy. And so for us, it's really important to focus on this topic, considering, really what is happening at the international level. So yeah, this accord is due, in 2025. So we will see what's going to happen, but that's why we think that's, very pivotal for us to keep this on focus. But obviously, there's a lot of questions that comes with One Health and how their approach can impact policy and governance. And so here, just to summarize what is the research opportunity that we see here as part of our work. We're basically asking what progress has been made regarding monitoring and evaluation for One Health programming across jurisdiction. So what we're saying is this, yeah, One Health is popping up in different places, at international level, at national level, potentially also local level. But how are we progressing with that since it's been in use now for some years? So what we want to unpack is really like trying to understand, what's actually happening out of the use of One Health and the One Health approach. And this also leads me to the next point, or the next topic, which is the climate emergency declarations. Because talking about jurisdictions, I think sometimes we tend to forget the local level. We tend to talk about the national level, the international level, but we know that local level, it's really important. And the why is because it's the local level that is feeling, the hurt of climate change and other environmental disasters. Here's just a picture, of the recent hurricanes in the US, but this can be any place, anywhere in the world. We see this increasing, everywhere, and with consequences, especially for communities that are already struggling. And so this is pivotal because it impacts community, it impacts local governments everywhere in the world. And so this is important from that point of view, but from a point of view of the system governance perspective is also because local governments are really taking a step in the right direction. We see a lot of jurisdictions in different parts of the world really committing to declare a climate emergency. And potentially this is due to the fact that they're feeling the hurt first. They're seeing the repercussion on their population. They need to respond. People ask them, they are in contact. Local governments are really in contact with the people, differently from national or international forums where, that contact might be a bit broken. Local government really needs to react. And so we see a lot of this kind of, commitment and try, to take action to mitigate in some extent, but also to really adapt to the current change of environment around us. And so we think that it's important to, from a system governance perspective, to really take in consideration this more lower level, let's say, of governance, which is so important and can feed back then at the national and international level. And so what we are trying to do within our working group is really asking some question around how are those declarations basically really, coming from a declaration to become an impact, to become an action. So you can see on the screen, the two main questions we're asking is that what impact does declaring a climate emergency has in terms of local government action? And does this influence engagement with an application of planetary health at the local level? And again, I take my other hat on here. I worked for an NGO before going back into research, which was working with local government and sustainability. And I can see how local governments are really trying to make changes. But sometimes, we don't really know what's going on. There's not much research on that side. And I think that's an important part of what we would like to do, to really see, from words, to talk, so from walk to talk, what's happening at the local level. And I pass on to you, Belle.
Many thanks, Gio, for the excellent overview of those two progress areas, which I think actually, again, lead beautifully into the next progress area, which Professor Catherine Bowen will present on, non-economic loss and damage, particularly when we think about those local level impacts. So over to you, Catherine.
Thank you so much, Belle, and everyone. I think this topic is just so important for us at the moment. We're really grappling with the concept of loss and damage, and it's something that the community really hasn't spent enough time to respond to. Sorry, I'm having a... So I've had some prompts, as we all have, for the discussion today. And what we can see on the screen here is a really great image that the UNFCCC put together. And we can see there's a combination of different types of events on the screen. So we can see the slow onset events. They're the ones that are surrounded by the darker blue. And they're the examples of those types of slow onset events we know, we're very familiar with, all of us, whether these are increasing temperatures, whether they are around loss of biodiversity, sea level rise. So many countries, particularly in our region here in the Indo-Pacific, are suffering now already from these types of events. And then we can see the extreme events in the orange or red, and we only need to look to the US for some extraordinary examples of those events in Florida over the last week or so. And we have a guest with us today, actually, Professor Ebi, who's sitting with us, who can hopefully, well, I'm sure will add to this discussion today as well. So these extreme weather events often get most of the attention in terms of loss and damage, because we can see these occurring before our eyes in many cases. So heat waves are another example of these types of extreme weather events. And as we flagged before we started this call, actually, Australia is facing one of our most concerning summers upcoming in the next few months, with heat waves really on our agenda. What is also important to note about these weather events is that we're no longer seeing them occur in isolation or one-off. So what we're now seeing is that there's very little time between a community experiencing a flood, for example, followed by a heat wave. And there's a reduced amount of time between these events. So the ability for communities and individuals to have the time to repair and respond and prepare for future events is just diminishing. So that's just a bit of general opening statements about the types of events we're going to continue to see, and the impacts of those on health in particular is something that we're most interested in. So going back a step, loss and damage refers to negative climate change impacts that cannot be easily mitigated or adapted to. These can be quantifiable costs, such as economic and individual livelihoods, and non-economic. So these are the ones that are really difficult to measure and compensate for. Loss of lives and worsening health outcomes, loss of cultural heritage and Indigenous knowledge, and ecosystem and biodiversity loss. And we can see those two divided in the bottom of this image here. And traditionally, we've really had a focus on the economic losses. So they are easier to quantify, particularly financially. So the non-economic losses have historically played a lesser role in terms of understanding the quantification of these losses, starting to put a cost to them, and then the policy responses in relation to, well, what are we going to do now that we do have an understanding of what these losses to individuals, our society, and our environment are. So it's a massive picture that we're dealing with. We're dealing with all of these events, as you can see, and this is just climate change. This is just one of our environmental challenges. So we know there are multiple environmental challenges, and we're just taking a narrow look at climate change and trying to understand the loss and damage that is currently being caused and will continue to impact all of our communities. And I think, as Rosalind mentioned earlier, we all have different levels of risks and vulnerabilities, and it's really critical that we do take this discussion seriously across a global perspective. So as many of you will be aware, there was a new loss and damage fund that was established at COP28, and there were finance targets that will be a focus of the upcoming COP29. However, there is, as you would expect, a lot of complexity around who's managing this fund, how it will be contributed, how governments likely will contribute to the fund, how it will operate, and how it's different from existing climate finance mechanisms. So I think that's also a critical point, because we do have multiple climate financing mechanisms, and the degree to which they're effectively operating is also a point for debate, I think. And now we've added another one. So it's an enormous question for our governance system. So how does loss and damage relate to the Earth System Governance Agenda? Well, the Earth System Governance Framework does offer some guiding principles for loss and damage mechanisms, including the emphasis that we've already heard about on planetary justice and equity. How do we develop effective and inclusive governance? And the attention that we must pay to the historical context. So, for example, as we've already heard, the inequitable distribution of both the impacts, but also the countries that have caused the most, the greatest levels of greenhouse gas emissions. So what are some of the key questions in these areas in the context of planetary health justice? So we've got a couple to start us off. They're pretty fundamental though, they're enormous questions. So the first one is, how can health be considered under a non-economic framing of loss and damage? So I think that that's something that the health community is quite interested in exploring, but there has only been a very, very small amount of work done so far on this issue. And the second key question is, how do we measure it? And what does it mean for supporting communities to progress towards planetary health equity? So they're very large questions, but it is basically starting from scratch for the health community. There's been, as I said, very little research or focus on this concept, and Chris probably has more to add on that. But it's really, there are so many crossovers between loss and damage and our work in the Earth System Governance Project. So I look forward to hearing discussions on this one, but also on the other topics that were presented before and will be after me. Thanks, Belle.
Thanks so much, Catherine, and so important to provide such a comprehensive overview on an area that, as you indicate, is very early in the stages of development and research. So most grateful for your overview of that progress area. Last but not least, it is my absolute pleasure to pass to my colleague, Dr. Rebecca Patrick, who will talk about the final progress area, artificial intelligence, and its relationship or positionality in our roadmap. Thanks so much, Rebecca. Over to you.
Thanks, Val. And I just want to take a small moment to pause and acknowledge the difficult topics and trends that we're covering in this conversation, and just really acknowledge all of my colleagues in this group and the colleagues that are joining this discussion in the roundtable for their enduring commitment to generating the science and undertaking the advocacy and really making the personal the political, and thank you very much, and just make that acknowledgement. Look, we've got one more polycrisis to discuss. I've been given the fun one, but you know, it's got some fun parts, but it's got some challenges. So I just want to draw your attention firstly to the roadmap and what we've stated in relation to artificial intelligence and planetary health justice. And in the roadmap, the draft roadmap, we've said many institutions are working at the critical nexus of AI and Earth systems governance, including the scrutiny of the ethical implications as the area rapidly evolving so quickly. Our heads, as human heads, are in a spin. And there's a number of questions that we're tracking in relation to our roadmap. They include, what will ensure humanitarian values are embedded into AI, and how do we navigate the new world successfully? And what are some of the frameworks that are going to help us move forward, not only on this particular dimension, but the interaction of these topics that we're raising here. So I want to draw your attention to the image on the slide. And I asked my little big friend, let's call it, ChatGPT, to generate this image. And I prompted it and I said, can you please create an image representing AI planetary health? And it gave me the first version, and then I kept prompting it and I said, can you please add some humans in here, human health? And this is where my friend ChatGPT landed. And the what came under the image was, this is an image with humans engaging in healthy activities like planting trees and doing yoga, representing the connection between AI, planetary health and human wellbeing. Let me know if you would like some further adjustments. I could have stayed with my friend ChatGPT for a very long time, but I stopped there. But I just want to acknowledge that, you know, the image is in the ballpark, but of course, we do experience with AI that it always feels not quite right and it's somewhat superficial, and we still very much need the human mind when we engage with tools like ChatGPT. So drawing our attention back to the 3 questions that we're all tracking in relation to these priority areas, we've all starting to have some experiences of the pros and cons of working with different AI tools. We know as scientists and people working in the climate health space, for example, that AI has and does have the potential for improving coordination and reducing response time in disaster relief and rescue efforts. That's a broad brush statement. I'll talk about vulnerable population, priority populations and low resource settings in a moment. It's also helping us with early warning systems for heat waves, such as in Philadelphia and Shanghai, flood prediction systems, such as in India and Bangladesh. But like I've just said, AI is meant to augment our human expertise and knowledge and not replace it. From planetary health equity perspective, there's many bias in underlying data or the underlying algorithmic processes that are resulting in these AI tools overestimating, or on the flip side, under prioritizing entire population subgroups. So it's only as good as the human data that we plug into the system. So I think we all have some shared experiences in playing in the AI tool. So now let's turn our focus to Earth systems governance and the challenges and opportunities of AI more closely mapped to those questions. So 4 that spring to mind, and a little bit of help with my AI friend ChatGPT, as we argued up 4 areas, one of which in terms of a challenge is the digital inequality. So the benefits of AI for planetary health can also exacerbate the inequalities of access to AI tools and infrastructure, which is concentrated in wealthier nations and regions, and therefore could have that dominoes effect of their leading to unequal environmental protection and health interventions. Notwithstanding the ethical concerns, such as how data from Indigenous lands or priority population communities is collected and used and stored. The power and control, I could spend another hour talking about that, as well as the sustainability of AI technology. We know the computational power needed for AI has a very significant footprint, and we're still very much grappling with that. The opportunities of a holistic Earth systems governance approach, a planetary health justice approach, is the potential for participatory AI governance. And that's up on the slide here, involving communities, marginalised groups in relation to the governance of these AI tools. There's the possibility of decentralised AI solutions, and I'm now just skipping over some of these. The sustainable AI development, of course, having a renewable powered AI-driven networks to ensure that we don't add to the carbon footprint problems, and as well as those policy and legal frameworks to regulate the way that AI is used, as well as promoting sustainability. So again, tip of the iceberg. There's that iceberg analogy again. You know, the bit we can see and that we're familiar with, and I think you can connect with in terms of your own experience as scientists and advocates and people that may have used some of the tools. In terms of some of the planetary health justice research opportunities, I've provided just one up on the screen, which broadly comes under AI-driven climate prediction and risk assessment for priority populations. But there's questions and research opportunities are endless in this space. I've had a little play with a local pot of money where we looked at the role of AI technology in supporting disaster impacted communities to write grants to access the necessary resources to recover and also plan for imminent threats. The fact that recovery is probably a redundant concept is for another day and another workshop. So I might just leave it there and hand it back to Belle. Thanks, Belle.
Thanks so much, Rebecca. And you never cease to delight and amaze me with your capacity to very creatively engage, for example, with ChatGPT to demonstrate the point as part of this particular progress area. So fabulous overview of the area in the draft roadmap, and thank you so much. For those of us who have joined, you will hopefully now see that we really do have our work cut out for us in terms of the 7 progress areas we have identified so far. I had set up an interactive session in the sense that using a technology, poll everywhere, so that we could really brainstorm on a few questions that we think are really pertinent to initially start refining and co-developing this roadmap. But I'm conscious we have a relatively intimate group, so I've decided that instead of using PolyV, we're actually going to have a conversation as a group. But before I do that, I'm aware that a few participants were not potentially online for the accessing of the roadmap. So I just wanted to quickly reiterate that the roadmap is available on the schedule for this particular event online and also at this QR code if you are interested in accessing that so that you can see the full version of the draft roadmap and provide input and feedback at a later date once we've had an opportunity to discuss initial thoughts and reflections. So I'm going to stop sharing my screen, and then Blake, I'm not sure if we have the capacity with the participants for them to be able to introduce themselves as part of the session, but given we've got a relatively small and intimate group, it would be wonderful if we could provide our attendees the opportunity to participate and engage with us, particularly as we explore 4 questions in particular. So the 4 questions we were really eager to get feedback on from participants in this session were, first of all, are there any key areas that we have missed? Is there anything absolutely critical that should be in this roadmap which is currently not in this roadmap, not captured? Acknowledging that there will still be opportunities to further articulate and refine the way that each progress area that is included is articulated. Secondly, we see and understand that there are undoubtedly going to be synergies within work that's happening in other task forces and working groups within the ESG community. And so eager to understand and know if you are formally part of the ESG community, involved in other working groups or task forces, where do you see the synergies with the other areas of work, and how can we collaborate across working groups, across task forces to really leverage our impact and maximise our impact as collective groups? The third question is around effective engagement with policymakers and practitioners. I think it's hopefully very clear that we are really eager to ensure that the work we undertake is not only delivered at scale, but also with commensurate impact, given the critical change we need to see and the progress we need to advance and drive forward. So really eager to get your thoughts and ideas on how we effectively engage in these particular areas with both policymakers and practitioners, not only within the ESG community, but beyond. And then the final question, just an easy one to finish on, is around how do we strategically position our work to ensure we're achieving longer-term impactful outcomes, acknowledging that the environments in which we work in, politically, economically, are often very short-term in their focus. How do we ensure that the work that we are doing is sustainable longer term and is impactful longer term, and really helps to drive that transformative change we know is absolutely critical if we're to achieve planetary health justice. So just 4 very easy questions that we're eager to explore and discuss as part of this roundtable session. And we've got about half an hour left. So I'm not sure, Blake, if it is possible for our participants to maybe just, I don't know if it's part of raising their hand or as part of the Q&A, being able to answer live. But while we work that through technically, I might actually pass back to the boardroom, where we have, as Catherine flagged, Professor Chris Eby with us, internationally renowned climate and health specialist, who might be willing, Chris, sorry to put you on the spot, but to provide your initial reflections and perspectives on what you've just heard about our draft roadmap before we jump into some questions. I think the room is still on mute, sorry.
Yeah, thank you, I think. Can you hear me? First of all, impressive set of presentations. Really appreciate all the time and effort people put into putting those together. They're an amazing resource. And I will start with a comment, particularly from Catherine. It's obviously more than climate change. And to think about bringing in different elements of global environmental change, which leads me to the Earth Commission. There was a publication that came out in Lancet Planetary Health a month ago on looking at safe and just planetary, well, Earth system boundaries, moving beyond planetary boundaries to Earth system boundaries. The purpose of the Earth Commission was to try and do for other Earth systems what was done for climate through IPCC and significant research investments. And so it does cover a whole range of other Earth systems. The purpose was to identify the biophysical kinds of thresholds that we know exist for climate, and then to articulate pathways for a safe and just future, where it's safe for the planet, but it's just for participants. And so there's a 70-page paper in Lancet Planetary Health talking about different elements of justice and how to think about bringing justice into these discussions. There's a lot of work that needs to be done in this space. It's not a heavily populated space. And mostly the analyses use poverty as a way to look at justice, recognizing that that's insufficient. And I would encourage you looking at what was done there and seeing how to bring some of the issues that were raised in this first round of the Earth Commission. There's another round of the Earth Commission underway that's going to be bringing in oceans in particular, and some other of the boundaries that just wasn't possible to do in round one. And then along with that, if you look at the Earth system boundaries, there's work on biodiversity, there's work on water. Water is going to be such a huge issue. And so I think there's a lot that can be gleaned from the 20 papers or so that came out from the Earth Commission. The main paper led by Johan Rockstrom came out in May last year. And lots of companion papers giving you lots more detail. But that might be a way to enrich what you're doing here and take a somewhat broader perspective on the governance question. Over.
Thank you, Chris. An excellent suggestion and a fantastic reflection. Sorry, Beck, did you have something to add?
No, I was pointing where to find it. It came up on the screen.
Oh, yes, excellent, fantastic. Thank you. I think Blake's just dropped a link to it in the chat. That's wonderful, Blake. Thank you. An excellent suggestion and a lovely way, I think, to potentially weave together the Earth System Governance Science Implementation Plan, which we used, I suppose, as a bit of a foundational document for the development of the roadmap in terms of the types of questions around governance we might ask, and really linking it very closely to seminal research from the academy that sits potentially alongside the Earth System Governance community. So really appreciate that suggestion. I'd now like to open it to our other guests, attendees who unfortunately we can't see, but would love for you to either raise your hand or type a question, or sorry, a comment or reflection in the Q&A function box. It would be really excellent to hear from Catherine, Daniela, Sam, or Aziz about your initial reflections on the draft roadmap, your thoughts about these areas and where there's opportunity potentially for us to strengthen, to broaden or expand the focus of our remit, or potentially respond to one of those 4 questions raised earlier around, synergies with other work happening, effective engagement with policymakers, practitioners, as well as thinking about how to strategically position our work to ensure that it is both transformative and sustainable longer term. Did anyone of our attendees have anything that they would like to reflect upon or comment upon as part of the roundtable?
There are a couple questions in the Q&A. Want to look at from Catherine?
Excellent, thank you. Just having a look at Catherine's responses in the Q&A for those online who might not be able to see. Catherine has shared an example of loss and damage from today's Washington Post, an article specifically around the situation in the US. Excellent, really appreciate you sharing that, Catherine, and potentially a resource or a reference that we can incorporate and integrate into the roadmap. And then the second point was in relation to population decline as an issue, with a 2024 report relatively recently released by the UN projecting world population to peak this century. Yeah, population decline. We certainly haven't covered that as a group. Does anyone on the working group have any initial reflections or thoughts on the issue or area, I suppose, of population growth, population degrowth, population decline, and its relationship, I suppose, to planetary health justice? Ideas about how we might potentially integrate it into the roadmap?
I'm off mute. Population is an important question. I think, it's often the elephant in the room. I'm not going to deal with the elephant, but I am going to say that I think I'm really pleased that that's been put up for our consideration. We certainly have, we look at population in terms of priority populations and the changing profile of our population, in particularly where our populations are in mega cities, as well as our ageing population and vulnerabilities, resilience, and wisdom of our ageing population as well. But I can't answer that question, but wanted to acknowledge that a lot of the focus has been on the nature of the population and the who constitutes the population rather than, you know, the number going up or down. But that's all I had to say in terms of reflection.
And I'd just add, Belle, while the mic's on here in the room, that you know, it's a very complicated and prickly conversation to be had, and the distinction that's important to make is population size is, of course, something that we need to consider as the Earth able to thrive beneath a well, we're still seeing a growing presence of humans, versus as individuals and as particularly many of us coming from wealthy countries, what is the level of our consumption? So I think it's really not black and white, this discussion about population, which is, I think everyone knows that there are so many different layers to this, and it's not a topic that's deterministic, and it's a very topic that's very, very sensitive. So I think if we were to deal with it, it would need to be in that, the full spectrum of understanding around populations, consumption as really one of the biggest threats to the way not only we live and how we're being impacted by environmental changes that we're causing because of our consumption, but also the terrible impact that's having on Mother Earth. And I see Gio's got her hand up, which is probably in relation, or might be in relation to this as well. But I'll pass on. Thanks, Belle.
Thanks, Catherine. Gio and then Scott.
Yeah, thank you. Yeah, I guess, population, it's always the elephant in the room, but as Rebecca said, I think it's an important discussion. And I think especially when we talk about planetary health justice, I think that's important because most time there is this kind of, on one side, like, oh, we should reduce the population, but what does that mean in terms of inequities and like who is targeted by this type of, narratives? Or on the other side, you hear things about, no, we need to increase, birth because otherwise our economic system doesn't hold on. And we see that a lot coming from Europe, and a lot of European countries are struggling with the aging population and a reduced number of birth. And so the political discourse is around like, we need more babies. And I think this links quite well actually with the topic that Scott presented, and maybe he has something to say about the well-being economy, because that kind of shifts also the narrative about like, oh, we have to maintain the current, what Catherine was saying, this kind of, production and extreme production and consumption. And so we need people, to produce and consume in order to, have our economy going. But if we approach the economy in a different way, then I think, we ask different questions in relation to population. It's not anymore about like having more babies or having less babies, but it's about like the quality of the life that people are alive today and the one that will be after us. So that's where I kind of feel that some of the topics that we have highlighted have a component in there, but we maybe didn't like, say it clearly, but it's part of some of the topics that we highlighted in the roadmap.
On to me. I think it was back in 1994, there was an international conference on population in Cairo. World came together with a couple of dissenters and said, we have a plan of action. We just need to fund it, and the plan of action never got funded. It primarily focused on healthcare and education for girls and young women. So from the vantage point of 2024, it seems pretty simple, but it also gave us a foretaste of why we might run the SDGs into the ground, as we're currently doing. So there could be some value in archiving that specific history. I want to go back even further in time to around 1970. The Club of Rome sponsored a report called the Limits to Growth Study. And periodically, researchers have gotten together and chugged through some numbers and asked, well, did the economists get it right when they shredded that particular report as, simplistic stupidity done by a computer, basically. And every time they've gone back and rerun the numbers reaffirmed the 1970 study. And that study painted a rather ominous context for the world we live in right now. These efforts to rerun this study have been done more regularly in the last decade. It's been done several times in the last decade, and it keeps showing the same thing. And one of the things it shows is that population will peak before 2050, or at least some of the model runs. I should be more cautious. Some of the model runs show that population will peak before 2050, and that we're tracking that particular pathway right now. And this makes absolutely no sense to us with our, very AI-oriented, tech-sophisticated world. It's inconceivable that this model, I mean, we basically have the same exact response as was given in 1970. So particularly at universities, these kinds of things don't get any traction at all. I would be cautious here and urge that this really requires a much deeper thinking about what might be going on here in terms of structural constraints, specifically around food production, and the way climate changes that are kind of starting to grab in a little deeper right now, particularly drought, really could have some bite that upend lots and lots of things in the world. So let's be cautious about that. Rapid increases in food prices, just from the experience of the last decade and the last 5 years even, we've gotten much more sensitive to that. And it's really not the rear view mirror. COVID was more the foretaste of the future, is what these model runs are telling us. I could go on a lot longer, but I'll pause there for the reality of our timelines.
Many thanks to both Gio and Scott for your reflections and comments on that particular issue or topic and how we might navigate that as part of the draft roadmap. I think this is certainly going to be up for further discussion at our next working group meeting, which is next month.
The Cairo topic is very safe. We should definitely revisit that.
We have another question in the chat from Sam. Sam, thank you very much for your question. Thank you for the presentations and this exciting discussion. Wondering if we could speak about whether or how students might be engaged or how the findings of the research might be reflected in educational resources and classes. An excellent question, Sam. And just to flag, I suppose, that as part of thinking about the draft roadmap, we did as a working group before releasing it, consider the potential to include a section specifically on stakeholder engagement, but decided that we would actually have this session first to receive input, particularly around that question of how best to very meaningfully engage different critically important stakeholder groups. And I would consider our youth as certainly one of those very critically important groups to engage. So I will open it to the group really to respond, I suppose, to that question, but also, and I appreciate it's difficult potentially to answer, Sam, but also to you, as a student, what avenues have you seen that have been effective to engage you in this space? And I know that you have engaged in the climate and health space yourself, and are doing a very interesting project at the moment, which you might like to speak to, but would be really interested in your thoughts about how you see the opportunities for youth as a critically important stakeholder to be involved in this type of work, and where we might potentially create opportunities or vehicles to ensure that that is translated via, effective or receptive avenues.
Thanks, Belle. Can you hear me?
Can hear you well. Thanks, Sam.
Thank you. I'm not entirely sure how to answer the question, but as you say, it's kind of planetary health is a new topic for me within the past year or so. But I've been really lucky to be able to research topics at the moment about planetary health. So I'm wondering whether this sort of project provides similar opportunities for other students to be involved in research, but also in terms of engagement. I think I wish that I had found out about planetary health earlier than I did. So maybe it's about kind of sharing the research that you're doing at conferences and at events that have students present, so that they can learn about it, kind of like the science expo that we had at Melbourne earlier in the year, because then it just kind of exposes students to what the research is about. Does that make sense?
Absolutely. And I think we do need to become increasingly creative and innovative about the different opportunities we seek to expose different groups to this particular space. Gio, I know notice that you have your hand up and would love to invite you to respond, but also just wanted to flag, and I'm not sure, Professor Eba, if you have any reflections on this, but I'm conscious of your work that has followed the disproportionate or limited funding that this particular area has received, and that obviously then has consequences in terms of the area. I'm about to cough, sorry. I'll pass to you, Gio.
As a fellow student, because I am a PhD student, I understand where you're coming from. I think maybe one reflection I have is that in the planetary health space, I know there's been quite a big push of the inclusion of planetary health education within certain university, but especially within the medical education. So the idea of having planetary health, for doctors, nurses as part of their curriculum. I would say that, so there is some openings there in some university around the world where this is becoming a bit more present. I would argue, though, that that should not just be for medical professionals training, but it should be something that it's for everybody. So whatever type of studies you're doing. And I would even go to say that some studies specifically would benefit more from this type of inclusion in education of this type of topics, far from economics. And so I think that's something to reflect upon, how to link with different education streams from our perspectives as a group. And the other thing, I think it comes from us as students to really engage, with others within our universities about what we're doing. And being part of this group for me means also to, talk with other students about what I'm doing and why it's relevant and why they should attend if we're having an event. And even if they think it's not relevant for them, it probably is. So, and then also talking with other academics and, trying to, make these conversations and happening, because I think that spawns then questions that you can put into grants and, and then doing research on this. And I think I'm in a university and in a school more specifically that has that transdisciplinary thinking, so it's a bit easier for me, but I know it's not easy for everybody to do that depending where you are at. But I think that's also part of us as students to try to mingle with each other and talk about this, and really talk about planetary health justice, but also our system governance more broadly, no matter what fields we're in. It's very common in social sciences, but coming from natural sciences, I know that's not like a topic of discussion, but that's where we also need to bring this type of conversations in.
Thank you for rescuing me there, Gio. And apologies if I missed it during my coughing fit, but you may have referred to some work that one of our colleagues is doing around the planetary health curriculum, although I do note that that probably has more of a core focus on the health and medical disciplinary fields as opposed to a much more broader remit. So wholeheartedly agree that we need to think more widely and broadly around that. So, but really, really generous of you, Sam, to share your experience of the, not having that exposure earlier on, because that helps us to think through when we're developing the roadmap, how we can potentially effectively engage different groups and what avenues might be worth exploring as part of that process. Scott, and then the room.
Gio shared with us the eco versus ego graphics, one a bit hierarchical and one definitely more circular and embedded ecologically. And I referenced David Corton earlier. In that same vein, he had a quote I wanted to share with folks today. He said, "Economics, maximizing the well-being of life using money as a means." Sorry, said that wrong. Eco-nomics versus ego-nomics, maximizing personal financial returns using life as a means. So I think there's really, to build upon a presentation that happened for in New York midday, to build upon that, there's an opportunity right now to really think creatively, even radically, about the university with its hierarchies of what an education is, and to explore, student interest in how to build more of a dialogic community, making sure the community is part of that dialogue, and exploring what it means to live in an eco university.
Many thanks, Scott. Over to the room.
Okay. Just acknowledging that the discipline of health promotion, which is broadly conceptualized as a subset of public health, has somewhat adopted the planetary health approach. So that's about health promotion and prevention. And some of that uptake came from a conference for the field being framed around planetary health, which laid the foundations for people associated with that area to adopt a planetary health approach. And I think it's there needs to be within your discipline a place to connect the new way of thinking and understanding. And so health promotion as a discipline is just one area. Sam, to your point around opportunities for students, emerging leaders, younger generations, there's, the informal and formal opportunities of education. For example, the graduate certificate in climate change and health we have here at the University of Melbourne, and one of our subjects is around planetary health. Also, working with your research supervisor and putting up the kinds of frameworks that you're interested in and really resonate for you, or asking for advice around frameworks that would help you develop a research question or research project and or interpret your findings of research. That's one other way that we invite people, students in particular, into the wonderful world of planetary health. There's an international organisation, the Planetary Health Alliance, and I know you, Sam, online, boldly stepped in to a role in the Oceania region without, you know, necessarily having a long history of involvement in planetary health, but said, hey, I get it, I want to learn more, and put yourself in a leadership role within the region as a comms and engagement person for the Planetary Health Alliance. So I just wanted to acknowledge your braveness in adopting this approach, and also your leadership in planetary health in this region. I'm really excited to see what else comes from your research and you adopting this particular approach. Thanks for joining us, Sam.
And I'll just add in a comment. I think everyone's inputs have been fascinating, and Sam, a great question. I think as universities, we grapple with a serious issue with our hierarchy, and it's the same with our curriculum. So we really don't ask potential students or current students what they would like to learn. It's very much a top-down approach. So raising voices is really important as the student community, and really we had a meeting today with a very senior university staff member, and very interested in how do we educate our students on climate change, but not entirely sure where to start. And I think that conversation has to be open to all. That we're in environments where our leaders are emerging from at the universities. So it's just really important that the pressure comes from the student side as well. So yeah.
Many thanks. It has been an incredible 90 minutes. It's gone very fast, at least from my perspective. I'd like to thank the working group again for their commitment to developing this draft roadmap, for presenting an overview of the 7 progress areas that we have identified so far, to the participants and attendees for their provocative questions, their really insightful comments and reflections that I think will really help us as we continue to develop this roadmap in the coming months ahead of commencing implementation next year. Whether you have been interactive and engaged in this conversation as part of today's event, or are watching this as a recording, please do consider being involved as we move this critically important work forward within the ESG community. You're welcome to be part of the working group more formally, but you're also welcome to just provide feedback or further comments on the draft roadmap, so that we can continue to refine and integrate and co-develop the roadmap going forward. Please feel free to contact me in the first instance as part of that endeavour, whether it is, as I said, formally as part of the working group, or to provide feedback on the roadmap. Thank you again for attending today. We really hope that you have enjoyed the session, and we really hope that you enjoy the rest of the forum as well. And please do be in touch. We really are eager to engage and ensure that we're connected with both eager, enthusiastic, passionate people within the ESG community and beyond, as part of taking forward this important agenda on planetary health justice. Thank you. I think we are formally done. I will take down this slide. Thank you all very much for your participation. To my wonderful working group colleagues, thank you so much, particularly Scott, Rosalind, and Blake for staying with us during this, during what is a very late hour for you. And I'm sure there are a few participants too who are at very late hours as well. So thank you very much.
Thank you.
Thanks,
Thank
Belle.
you.
Bye.
Bye.